So the next speaker is Dr. Michelle Cotton Laws. She's a fierce social justice warrior and one of the most powerful speakers I have ever heard. Her day job is as an assistant director, well, one of them is as an assistant director of program development, outreach, and research at Community Health Coalition, Inc., which provides culturally sensitive health education and disease prevention activities to communities in Durham and surrounding areas. Michelle?
I really feel like I should just come up here and drop the mic for Dr. Aparna. She was great. The title of my talk, initially the title is Unclean Hands, because as a person that works in population health, in the population health area, we know that we're all taught to clean hands, and then also as a way to control germs and disease and so forth. But also as a minister, there's a story in the Bible about Pontius Pilate, from my faith tradition, saying that he will have nothing to do with the crucifixion and trying to clean his hands. You can go to the next slide. When I think about the healthcare system in America, I clearly see where there are a lot of actions that are being taken deliberately by our elected officials at not just the national level, but here in North Carolina, a state that refused Medicaid expansion at the state level, and then that, of course, can trickle down into some communities. It hasn't happened yet here in Orange County or in Durham, but in some communities, and particularly rural communities, where we see very clear indication of unclean hands when it comes to health care, creating a system that really isn't a health care system, but for some, it's a death care system. Because if you are poor, if you are elderly, and God forbid, elderly and poor, and then on top of that, a woman or ethnic minority or a member of any of the LGBTQ communities, and I know there's a new letters or identifications that's added to that, but if you are a part of a historically marginalized group in our society, in America, what we are seeing, the results of the practices that are translating into policies are not providing a healthcare system that will ensure greater quality of life and well-being, but it really is a death care system. All you have to do, that picture there, is actually a picture that I have used in presentations since 2005. Anybody remember what happened in 2005? Hurricane Katrina. This is actually a picture of an African-American woman who was sitting among the thousands that were at the Louisiana Superdome, waiting for their country to respond quickly and swiftly to prevent the deaths and to prevent the decline in the quality of life that people were experiencing. It was during Hurricane Katrina and the aftermath and the way in which we responded, or lack of response, through policies to deal with some of the serious healthcare issues that people were experiencing on the ground, and particularly mental health issues. It was that lack of concern, that lack of just humanity that caused me to begin to shift my focus and my interest to the healthcare setting. Whereas prior, I was doing social justice work, really focused on civil rights, and not really plugged into the inhumanity and the fact that healthcare is indeed a civil rights issue. Next slide. And so I'm here really to kind of lift up what many of us already know, and that is health policies don't just happen in a vacuum. They happen with some harsh realities as the background or the backdrop. Life expectancy, when we think about it, for certain races, going back to this death care versus health care system, we know for African Americans, for example, African American women as well as adults, we have the lowest life expectancy rate compared to other ethnic and race groups. And I wish I could say that that varies based on socioeconomic status, that if you're African American and female, the higher your SES or income or wealth is, that this is not true, that you're less likely to die, or that it somehow equalizes or levels out. But that is not the case. Next slide. When we think about why that's not the case, along with some other things that we'll talk about, oftentimes we like to shift the focus from the big R word, racism or discrimination, and we plug in all of these other determinants of health, which are important. It's important for us to certainly recognize the effects that early childhood development has, and therefore put funding into pre-K programs. It's important for us to recognize that if you are unemployed and don't have a job, that it's important for us to create policies and budgets that are morally responsible and responsive and put money into those places. However, it becomes politically expedient to blame the victim for poor health and to look to these core determinants of health and act as if there aren't people sitting in our legislature, sitting in Congress with unclean hands that are deliberately writing policies to not only create what we find are some of the core determinants of health inequities, but are creating poor health outcomes and early death for certain populations. Next slide. It's all relative. Social determinants of health are factors that do affect poor health, but we call it in the social sciences, there's a recursive relationship. Poor health affects also the quality of life and well-being. If you are unhealthy, you can't work a stable job in some instances, like the story we just heard, the case that we just heard about the scoliosis victim. If you, patient. If you have poor health, you're more likely to miss days of work, therefore putting the jobs that you may have on the line. If you have poor health, especially when we think about children and their inability to compete academically, it affects educational achievement, it affects housing, economic status, the likelihood of incarceration, overall sense of well-being, the likelihood of incarceration. Oftentimes you find people who, and particularly in the African American and Hispanic and Latino communities, that are victims of unjust justice policies and who are really pawns in this whole prison industrial complex. It's necessary for us to fill these prisons in order to make sure that those who are profiting from the prisons and those who often are profiting from the prison industrial complex have some reach into our political system. But many times, if you look at the data and disaggregate the data, it's not violent crimes that most persons are incarcerated for. Many times, it's crimes that are due to let's say addiction, substance addiction. And so people will find themselves in a situation where they're not getting treatment, mental health and substance abuse treatment on the ground. Why? Because of policy decisions that are made that take money from mental health and substance abuse services, close down public health facilities or units or departments that treat the mentally ill and that provide services for substance abuse patients. And so we find that people will end up doing whatever they can do or is available to them to support substance addictive behaviors and end up incarcerated. It's a never-ending cycle when we don't take time to understand and dissect how all of the changes that we see that happen at the Health and Human Services level as well as the social services level in terms of budget cuts, in terms of draconian laws that prohibit certain people from accessing care. So if you have a criminal record, you can't get social services. What sense does that make? So what does that do for somebody's health care? What does that do for somebody's mental health? Next slide. So we find ourselves caught up in the middle of this debate, and very interesting dialogue about whether or not the ACA is worth saving, whether or not it is the problem leading to the exorbitant, extravagant expenses that we see in the healthcare system, or is it the root cause? It's neither. The fact of the matter is that the ACA is an approach to fix portions of the problems contributing to the healthcare crisis in America. It is not the problem, nor is it the cause. However, again, it was politically expedient for certain groups to spin that narrative and to hold on to that narrative. And so the alt-right, blaming Obama and Obamacare, I still refer to it as the ACA, but blaming that as the ill or the cause of outlandish and outrageous medical costs is preposterous. And it's up to us, those who know the truth, to call a lie a lie. I'm from the old school. I'm from Chapel Hill. I'm from a public housing community and working away. It's time for us, and we played spades. It's time for us to call somebody on their hand, or as they say, call a spade a spade. And when we remain silent about the connections and about what we clearly can see are deliberate attempts to penalize and punish certain groups or to exclude certain groups, then we too share in the blame in terms of why the system is the way it is. I say that there are many causes, and when we look at the root causes, structural inequalities, inequities, social determinants, and especially poverty, in the environment, the way in which many of us have allowed certain groups to hijack the discourse and to take over science and to try and tell us what we know to be true is a lie, and that the lies that we know that are out there are actually the truth. It's time for many of us to wake up and to speak loudly and to stay woke and to stay engaged. Some of us, some communities know how deliberate the attempts are, usually through policies that some elected officials attempt to dress up and make it seem that that there is no harm. Many of us know, and we don't think that it is, conspiracy theory or outrageous to put this out. We know the harm that what our government can do. People in my community, in my ancestry and family, know clearly how complicit the U.S. government can be in creating health disparities and singling out certain groups. Tuskegee Syphilis study, does that ring a bell? That was sanctioned and commissioned by the U.S. government. And what's so interesting about it is when they were forced to close the study down, guess where the lead researcher fled to? Guatemala, and was allowed to exist practicing using the Guatemalan people as guinea pigs in medical research, and you can, just as they did in Tuskegee in 1932. But that experiment was commissioned by the U.S. government. And there have been other experiments, next slide, where there's clear evidence, historical documentation, that leads us all to understand that we must be mindful and not simply allow policies to be created in a vacuum or in the dark halls of Congress. Anytime there's legislation that's put on the floor or that's being considered that deals with the health and well-being of American people, we all need to get a copy of it, and we all need to read it. We all need to ask for interpretation, and we need to ask and hold our elected officials that represent us accountable. How many of us have called Price, or how many of us have called Tillis or Burr and asked them to specifically to explain any parts of legislation, any pieces of the ACA, at a level that we understand it and make good sense, and then not only explain it, but explain their position and why they have that position, and then keep a record. It's all relative. Next slide, and I'm trying to speed through this. So you can go to the next slide. And so when we think about North Carolina, for example, and the decision of our state legislature to support our then governor, Governor McCrory's decision not to accept the expansion of Medicaid, which we would have been paid to take care of the sick. What sense does that make? We would have received money in the state as opposed to the narrative that the narrative that the idiots in the North Carolina General Assembly on the far right side created and spun and repeated over and over and over again to justify the harm that they were fully aware that they would commit. We allowed that. When you didn't show up at Borough Mondays, when you didn't write to the members of the North Carolina General Assembly, when you sat on the sidelines, we allowed that. But when we look at gap in coverage for non-Medicaid expansion states, we can see the connection between those who I mentioned before who've been historically marginalized, those who have been struggling, the working poor, the people who get up every single day and clean our hospitals and clean our skilled care facilities, pick up our garbage. Those were the ones who fell in between that Medicaid gap. And when we failed to push and to require that the members of the North Carolina General Assembly moved on what we knew was prudent, just, and moral actions to expand Medicaid in North Carolina, we helped them to stay stuck in that coverage gap. Next slide. We know about poverty in North Carolina, and the only thing I want to say about that, if you'll go to the next slide, is there's a correlation between the poorest counties and the sickest counties and those without health insurance. I want to bring this point into this part. We have people that are propagandizing this story of America, of who made it to the top. And they're spinning this interesting tale of meritocracy, that those who made it to the top are those who worked hard, when in fact those who represent the 1%, the richest 1% of families, who control a record high of 38.6% of the country's wealth in 2016, according to a recent September 2017 Federal Reserve report, while the bottom 90% of families struggle to hold 22.8% of the wealth down, which is insane in supposedly a democratic country. When we think about this narrative that people, and this story that they tell us, that those who make it to the top and who are running corporations where they're making 800 times more than what the frontline workers are, the CEOs of these corporations, and that all we have to do is simply cut their taxes, don't require them to pay an equitable distribution of taxes, that like Reagan tried to make us believe that it'll trickle down to the bottom and it'll lift the American economy and the American people. That is a bunch of crap. That is hogwash. That is insane thinking. There's nothing true about it. There's nothing prudent or wise about it. And in fact, when you look at those who are in control of the wealth and therefore in control of Congress and therefore in control of the policies that are written and that are passed for a large degree, although they may make up a very small number, NRA folk, a very small number, when we listen to these stories that we want to cut social services or we want to cut what they call entitlement programs because people should work for what they get, then we should tell them, okay, well, let's put all the money in the pot, shake it up, because half of you all did not work, but inherited the wealth that you have, and you're making sure that your children and their children inherit the wealth that is passed on in America and hoarded. Nothing's going back down to the frontline workers in terms of the profits that are made. And then the same people are the ones that say they should also have to pay a larger proportion of health care. It's crazy. It's simply crazy. Next slide. I put these up, and I'm not sure. There are just certain groups that are suffering and that have been. This is the unemployment rate, and the comparison, as you can see, just look at the y-axis. African Americans has been in the double digits for quite a long time. Towards the end, if you'll flip through, flip through, flip to past that. So the harsh realities are, when we think about policies, I wanted to bring in these quotes because they really sum up the crux of it, the meat of it. All diseases have two causes, one pathological and the other one political. You heard the Dr. King quote, but Warren Buffett also said something not too long ago, that there is class warfare, all right, but it's his class, the rich class, that's making war, and they are winning. Next slide. And so I love this picture and this quote. One day the poor will have nothing left to eat but the rich. And then in my summation, policies just don't happen. People are deliberate in making them happen. Healthcare policies are linked to every quality of life indicator, and make no mistake about it. Stay informed, stay engaged, read the policies, and respond when necessary. Don't give up away to apathy or succumb to sensory overload or constipated with the never-ending deluge of the politically and socially outrageous and unconscionable. And Frederick Douglass said it best. Those who profess to favor freedom and yet deprecate agitation are men who want crops without plowing up the ground. They want rain without thunder and lightning. They want the ocean without the awful roar of its many waters. This struggle may be a moral one or it may be a physical one, and it may be both moral and physical, but it must be a struggle. Power concedes nothing without a demand. It never did, and it never will. Find out just what any people will quietly submit to, and you have found out the exact measure of injustice and wrong which will be imposed upon them. And these will continue till they are resisted with either words or blows or with both. The limits, and this is where we are today with the healthcare debate, the limits of tyrants are prescribed by the endurance of those whom they oppress. We cannot give up on this fight for a single-payer healthcare system in the United States. We cannot give up on the fight for health care for all, and that is why I'm fighting, y'all.